Thinking about trading the skyscraper shadows for palm trees? Or maybe you think the Big Apple offers better care for your golden years. Before you pack your bags, you need to look at the real numbers. We aren't just talking about rent, we are talking about your physical safety and your financial survival. Welcome back to Cost of Living Insider. Today, we are putting two titans in the ring, the Sunshine State versus the city that never sleeps. Is Florida actually safer? Is NYC's healthcare worth the price tag? Let's dive into the data. The safety landscape, crime statistics tell a nuanced story. When evaluating safety for older adults, the data reveal surprising contrasts that challenge common assumptions about both Florida and New York City. New York City's remarkable transformation. Despite its historical reputation, New York City has achieved one of the lowest violent crime rates among major American cities. According to FBI Uniform Crime Reporting data for 2023, NYC recorded 4.8 violent crimes per 1,000 residents, significantly lower than the national average of 5.7 per 1,000. The city's overall crime index sits at 24.8, where lower numbers indicate safer conditions, placing it favorably against many smaller metropolitan areas. For seniors specifically, Manhattan's Upper East Side, Brooklyn Heights, and Forest Hills in Queens maintain violent crime rates below 2.0 per 1,000 residents. The NYPD's Community Affairs Bureau reports that crimes against seniors, defined as adults 60+, constitute only 3.2% of total crime incidents citywide, with dedicated senior protection units operating in all 5 boroughs. Florida's complex crime picture. Florida presents a more varied landscape. The state's overall violent crime rate stands at 3.8 per 1,000 residents, but this masks dramatic regional variations. Miami-Dade County reports 6.4 violent crimes per 1,000 residents, while Naples, Collier County, records just 1.9 per 1,000. Popular retirement destinations show these disparities clearly. The Villages, 0.8 violent crimes per 1,000 residents, 2023. Sarasota, 2.4 per 1,000 residents. Fort Lauderdale, 5.7 per 1,000 residents. Tampa, 4.9 per 1,000 residents. Jacksonville, 6.2 per 1,000 residents. The Florida Department of Elder Affairs documented 37,482 reports of elder abuse, neglect, or exploitation in fiscal year 2023, representing a rate of 8.3 incidents per 1,000 seniors, slightly above the national average of 7.6 per 1,000. Hashtag healthcare access, density versus specialization. The healthcare equation involves far more than proximity to facilities. It encompasses specialist availability, wait times, quality ratings, and Medicare acceptance rates. New York City's healthcare ecosystem. NYC boasts an extraordinary concentration of medical resources. The metropolitan area houses 68 hospitals with specialized geriatric units, including 11 ranked nationally in geriatric care by U.S. News and World Report. The physician-to-population ratio stands at 482 doctors per 100,000 residents, the highest density in the nation. Key metrics for older adults include: geriatric specialists, 3,847 certified geriatricians practicing in the 5 boroughs. Average wait time for primary care, 14.3 days, 2024 data. Medicare Advantage enrollment, 62% of eligible seniors. Hospital quality, 84% of NYC hospitals achieved 4-star or 5-star CMS ratings. The Mount Sinai Health System, NYU Langone, and New York Presbyterian collectively operate 19 comprehensive stroke centers and 23 cardiac catheterization labs, providing critical care access within a 15-minute ambulance response time for 94% of the city's population. However, challenges exist. The average emergency room wait time across NYC hospitals reaches 3.7 hours, and only 73% of specialists accept new Medicare patients, below the national average of 81%. Florida's healthcare strengths and gaps. Florida's healthcare infrastructure has expanded dramatically to serve its 4.6 million senior residents, 21.3% of the state population. The state operates 218 hospitals with 58,742 total beds, translating to 2.7 hospital beds per 1,000 residents. Regional healthcare metrics vary considerably. South Florida, Miami-Dade, Broward, Palm Beach. Geriatricians per 100,000 seniors, 14.2. Top-ranked hospitals, 7, including Cleveland Clinic, Florida, Baptist Health. Average specialist wait time, 22.6 days. Medicare acceptance rate, 87%. Central Florida, Orlando, Tampa, St. Petersburg. Geriatricians per 100,000 seniors, 11.8. Top-ranked hospitals, 4. Average specialist wait time, 28.4 days. Medicare acceptance rate, 91%. Southwest Florida, Naples, Fort Myers, Sarasota. Geriatricians per 100,000 seniors, 9.3. Top-ranked hospitals, 2. Average specialist wait time, 31.2 days. Medicare acceptance rate, 89%. Mayo Clinic in Jacksonville and Moffitt Cancer Center in Tampa provide world-class specialized care, but rural and exurban areas face physician shortages. 16 Florida counties have no practicing geriatrician, forcing seniors to travel 45+ miles for specialized care. Hashtag the cost of living reality check, numbers that matter. The financial dimension of choosing between Florida and NYC involves far more than simple housing costs. It encompasses taxation, insurance, utilities, and hidden expenses that significantly impact fixed retirement incomes. New York City's premium pricing. According to the Council for Community and Economic Research's 2024 Cost of Living Index, Manhattan scores 227.8, where 100 represents the national average, making it the second most expensive urban area in America. Brooklyn follows at 178.4, with Queens at 152.6. Housing costs asterisk. Median rent, one-bedroom apartment $3,850 per month in Manhattan, $2,680 in Brooklyn, $2,240 in Queens. Median home price, $1,150,000, Manhattan, $780,000, Brooklyn, $595,000, Queens. Average property tax, $7,200 per year on a $600,000 home. Monthly living expenses for a single senior, 2024. Rent/housing, $2,400 to $4,200. Utilities, electric, gas, internet $185. Groceries, $425. Transportation, MetroCard $132. Healthcare premiums/out-of-pocket, $380. Miscellaneous, $350. Total, $3,872 to $5,672 per month, $46,464 to $68,064 per year. The tax burden adds complexity. New York State imposes income tax rates from 4% to 10.9%, while NYC levies an additional city income tax of 3.078% to 3.876%. However, seniors benefit from a $20,000 pension and annuity income exclusion, plus property tax credits up to $375 for homeowners. Social Security benefits remain untaxed in New York, providing relief for the 89% of NYC seniors receiving benefits averaging $1,827 per month. Florida's financial advantages and hidden costs. Florida's appeal stems largely from its tax structure: zero state income tax, no estate tax, and no inheritance tax. Social Security benefits go completely untaxed, as do pension distributions. Heat vulnerability in Florida ***. Florida's subtropical climate presents genuine health risks for older adults. The state recorded 1,247 heat-related emergency room visits among seniors in summer 2023, with heat index values exceeding 105 degrees Fahrenheit on average 67 days annually in South Florida. Seniors with cardiovascular conditions, diabetes, or kidney disease face elevated risk. Air conditioning becomes non-negotiable, yet power outages during hurricanes can create life-threatening situations. The 2022 Hurricane Ian resulted in 12 heat-related deaths among seniors who lost power for 5+ days. NYC's four-season challenges. New York's winter conditions pose different risks. Annual snowfall averaging 30 inches creates fall hazards, with seniors accounting for 42% of weather-related emergency room visits during winter months. However, the city's emergency management department operates 483 cooling centers and 500+ warming centers, providing refuge during temperature extremes. Climate change projections suggest both locations face increasing challenges: more intense hurricanes for Florida, Category 4+ storms projected to increase 45% by 2050, and more extreme heat events for NYC, days exceeding 90 degrees Fahrenheit projected to triple by 2050. #Healthcare quality, outcomes that matter. Beyond access, healthcare quality determines life expectancy and well-being outcomes. Comparative health metrics *. 30-day hospital readmission rates, Medicare patients. NYC average, 14.7%. Florida average, 15.9%. National average, 15.2%. Patient safety indicators, infections, falls, complications. NYC top-rated hospitals, 8.2% incident rate. Florida top-rated hospitals, 9.1% incident rate. Life expectancy at age 65. NYC, 21.3 additional years, women, 18.6 years, men. Florida, 20.8 additional years, women, 18.2 years, men. National, 20.5 additional years, women, 18.0 years, men. NYC's slight edge in longevity likely reflects healthcare density, walkability, and cultural factors beyond pure medical care quality. #The verdict, matching location to individual priorities. The choice between Florida cities and New York City ultimately depends on personal values, financial resources, and health status. Choose NYC if you value walkability and public transit. Prioritize cultural amenities and diversity. Have substantial retirement savings, $500,000+. Prefer accessing specialized healthcare easily. Don't mind cold winters and urban density. Seek intergenerational community interactions. Choose Florida if you want to maximize retirement dollar value. Prefer warm weather year-round. Are comfortable driving or in golf cart communities. Value outdoor recreation and golf. Have fixed income under $60,000 per year. Seek age-focused community environments. The hybrid approach *. An increasing number of retirees adopt a snowbird strategy, maintaining residences in both locations. Approximately 920,000 seniors split time between Northern and Florida homes annually, though this requires significant financial resources, typically $750,000+ in assets. For most seniors, the decision hinges on a careful assessment of three factors: financial sustainability over 20 to 30 years, healthcare needs likely to emerge with aging, and the lifestyle that brings genuine fulfillment. The data suggests both environments can support healthy, engaged aging, but through dramatically different pathways and at vastly different costs. The most critical factor isn't geography but planning, understanding true costs, securing appropriate healthcare coverage, establishing social connections, and maintaining realistic expectations about the aging process itself. Whether enjoying a Broadway show in Manhattan or watching the sunset over Tampa Bay, successful aging requires intentional choices grounded in personal reality rather than retirement fantasy.